All right. Thanks so much for being on this podcast. My first question that I had,
Pleasure.
yeah, my first question that I had for you is tell the audience a little bit about yourself and how you started in the work that you do today.
Sure. My name is Ninel Simonian. I'm a psychotherapist. I specialize in anxiety disorders, specifically fears and phobias. I normally work with very high functioning adults who deal with high levels of stress. I utilize different modalities more tailored towards the life today and the solution focused environment we are in. I use modalities that are faster than the traditional therapy, is more of result oriented, shorter term, more effective. Love traditional talk therapy too, but the focus in my practice is more on different types of modalities that I use these days with my clients. How I got into this, it's a long story. So, I used to be in business management and accounting, and I was sitting to take my CPA exams. Started going to see a therapist because it was a very stressful period. Uh, and at that time, I remember I had just got to the States. So it was a big life adjustment. And one day I was so pissed off with studying. I sat there in my therapist's office and I said, I can't do this all day, every day, working with these boring numbers. And she said, what do you want to be then? It's like, I want to be you. I want to be a therapist. So that was the start. I switched to psychotherapy, which I always loved as something that I was interested on the side, reading, going to webinars, conferences. So it was my passion always, but I never considered it as a career. And I switched to psychotherapy and never regretted it.
Yeah, that's good. I've heard countless times those stories before where like they're in marketing, but then like this is not what I want, but I want something different, so I can relate. Yeah.
Yeah.
But my next question is, you said that you work with you have a different style of modalities, like the traditional modalities. So what exactly do you mean by that?
So, when you talk about psychotherapy with people, the first thing that comes to their mind is sitting in an office, talking to a therapist nodding, kind of validating what they're feeling, asking them how they feel, and uh, that would be the therapy. And unfortunately, most people feel it's a waste of time when you just go somewhere and talk to someone for them to nod and validate you. Not saying it's wrong, and not every therapist is like that, but unfortunately, that's the perception. Nowadays, with all the knowledge we have, with all the research, we have so many evidence based modalities from bilateral stimulations. Um, all short term kind of solution focused modalities that if therapists are interested in them, they help both the therapist with being more effective and also with the clients getting more and faster results in a short time. So, with this fast paced life, people really don't have the time, the luxury of the resources to come in frequently. So you need to update your skill in a way that helps your clients the best in a short amount of time and serves them with kind of today's life environment.
Hmm. So yeah, and I can totally get that because oftentimes, like you said, some people say, "Oh, it might be a waste of time," but for others, it could be a useful benefit. Like I use therapy because I need to talk about my problems and stuff. So yeah, it's a really useful sort of tool. Because I remember talking to a guest and she said oftentimes, therapy is for crazy people. Obviously, that's not true. Everybody uses it. So,
Everybody uses it, and honestly, it's a luxury. Unfortunately, it's not accessible as you would want it to be for everyone. Um, and I'm happy, honestly, with the younger generation these days. Clients come in and they brag about going to therapy rather than um, in older days, people, as you said, saying therapy is for crazy people. But I'm very happy that the younger generation is much more open, understands the value, and they feel it's something that they are not ashamed of saying out loud that they go to therapy and they enjoy being in therapy.
Yeah, like the younger generation like understands that and is more open to that, but it's just like the generations before us, it people are like, well, why do you need it? I mean, cause cause it's helpful for me, like, just generations think differently, I guess. I don't know why.
That's very correct. I mean, there wasn't that much information there. It wasn't very popular and acceptable for people to go to therapy before. So it was the stigma around therapy that made the older generation feel hesitant about therapy and seeking help. But fortunately, it's changing.
It is changing. So like what sorts of populations or stuff do you work on with clients?
The population I work with is usually high functioning adults who deal with mood disorders, specifically anxiety disorders. So, any type of life transition, work life balance, any type of phobias, fears, trauma based issues that they are dealing with. So, it's a wide range, but I enjoy working with anxiety the most.
Mm-hmm. What have you learned in working with patients that are dealing with anxiety, as a clinician?
Um, There are several things, but what I see frequently is that people with anxiety sometimes, most of the time, they also deal with characteristics that otherwise are considered positive, like perfectionism. They take the word and they love it. I'm a perfectionist. I do my work on time, very detail oriented, very punctual, and these characteristics get rewarded, especially in places like workplace, right? If you are finishing your projects on time, if you are always punctual, on time to work, you get rewarded for that behavior. Unfortunately, that increases anxiety internally and people suffer with this tendency to perfectionism. Therefore, on the side, they also deal with procrastination, and then procrastination, which normally they label as laziness for themselves, then that leads to shame, and it's just a vicious cycle continuing.
Mm-hmm. Like it's really interesting that anxiety it leads to perfectionism. I did not know that. It's something I did not know. But
Yeah. So, anxiety is about uncertainty, right? Uncertainty brings up anxiety internally for us.
mhm,
Our brain wants to have some sense of control over our environment. And when brain feels it doesn't have control over the environment, what happens? It clings on to something that can insert control on, let's say a work project, and starts that loop of perfectionism there because now this one thing is in my control, so I'm gonna do it the best I can so that I can reduce the anxiety. So that's the mechanism underneath the perfectionism and how it gets linked to anxiety.
mhm. And what about people pleasing? Is there a link between that and anxiety?
Definitely, people pleasing usually is a very early childhood rooted issue, right? When we are kids, we are pretty helpless. We are dependent on adults in our lives, specifically parents at the beginning, to survive, right? For everything, we need them.
Hmm.
So even if we disagree with things that we are asked for by parents, we give into it because we want them to be happy with us. So people pleasing starts right there from early years, and then we take that and model it in later years of our lives when we become adults. That's the same pattern we follow because we don't want to disappoint people. So, what happens when, as an adult, or teenagers mostly as well, we fall into people pleasing. We ignore our own needs and our own boundaries, and we say yes to people even if we don't want to keep them satisfied and to not disappoint them. And unfortunately, even though momentarily it makes us to not feel that discomfort of saying no to someone, but then internally we start falling into this uh, internal struggle of I wasn't able to say no. I don't want to go to that place. I don't want to do this. I'm a lot of blaming and shaming of not being able to speak up. And it brings a lot of resentment towards self. That's how people pleasing spikes anxiety, right? You don't want to do something, but you gave into it. Now you're stuck, and it's even more difficult now to withdraw and say no, and spikes up anxiety.
Hmm. I feel like it's harder for people not to say no to certain things because we're always so accustomed to saying yes to everything. Like we're so hardwired. Yes to certain
Very true.
commitments. Yes to this. Yes to that.
Very true. And one of the tricks that you need to use when you identify as people pleasing, having people pleasing tendencies, is being able to put a gap into hearing a request and responding to the request,
Uh,
right? Don't immediately jump into saying yes. Take your time, ask for time, right? I'm gonna get back to you after I look over my schedule or after I check with so and so about this plan. So you give yourself time to process, time to come up with a response that's easier for you to communicate, and also it doesn't jeopardize your own needs.
hmm. Oh, what have you learned in doing this kind of work in the mental health space? Is there anything that you've taken away from, working with clients and anxiety?
With anxiety, necessarily, or in general, actually, I'm fascinated with human natures. I learn so much from my clients. I would never change this with anything else. I would never replace my job with anything else. The amount of satisfaction I get from working with people and learning from them, it's enormous. But what I learn about mood disorders, anxiety disorders, sometimes there's a genetic component into it, right? We want it or not, we are wired a certain way. And sometimes those genetic factors uh, are there, unfortunately. So, from that moment that we are born, we have a certain temperament, and there is not much we can do with that part of it. But as long as the person is willing to let go of that mentality of, I'm doomed to feel this way, I'm destined to be an anxious person or a depressed person, as long as they let go of that mentality and they feel, okay, there is a part that I can't change, but there are so many that are in my control, and I'm going to do whatever I can, or I'm going to learn whatever I can and utilize it and change the part that I can. When people get to that point that I'll let go of the parts I can't control and I'll change up the ones that I can, that's when the change happens. And you see drastic changes in people that otherwise they struggled years and years with so many symptoms and they didn't even realize that it was solvable or treatable.
Hmm. And is there anything that you want to learn as a clinician in terms of something new? Is there like a new modality that you're curious about that you're like, I'm curious about or want to learn more about this even further?
Definitely. I'm one of those who always looks for new modalities. These days, there are so many always popping up everywhere, right? And I look into them. I really research to see which one is gonna serve the best with the type of clientele I work with. And I definitely go get trained. The number of letters and certifications I have in this drawer next to me, um, I keep myself updated. However, one of the ones that what I'm looking forward to is with the neuroscience showing so much progress in the field. I'm very hopeful that very soon, in few years or so, we're going to have drastic changes in mental health. We learn more and more about how brain works and the physical aspect of all these mood disorders that we deal with. And I'm very hopeful with the neuroscience progressing, we're going to have very effective treatments that is going to be a shortcut in treating mood disorders. So that's the part that I've been looking for any related trainings, any related modalities that are kind of connected to more of the brain function.
hmm And lastly, what tips and advice would you give to those who want to do what you're doing, who want to, like work with anxiety or just work in mental health in general?
It's a very fulfilling job. However, it's also very emotionally taxing and draining if you don't know how to take care of yourself and what type of treatment to provide so you don't fall into burnout from the get-go. If you have the passion for it or if you have the personality for it, because it also requires a certain type of personality to work with people all day, every day, and to hear all these loads of traumas and problems. Even though it's very fulfilling, it can also be very draining. But if you have the passion, go for it. It's one of the most rewarding fields that you can get into.
hmm yeah, I bet. All righty. Okie dokie.